So now that we know what tuberculosis is, I would just like to talk about some of the signs and symptoms and how to recognize tuberculosis. According to the CDC and Mayo Clinic, which had very similar signs and symptoms, the following are signs and symptoms of active tuberculosis. A cough that lasts 3 or more weeks, coughing up blood, chest pain or pain when breathing or coughing, unintentional weight loss or loss of appetite, which ties to that, fatigue, so you're very tired throughout the day, fever and night sweats kind of go together, as well as chills. So tuberculosis can also affect other areas of your body, including kidneys, spine, or brain. When TB occurs outside of the lungs, the signs and symptoms vary just depending on which organ is involved. For example, if there's tuberculosis of the spine, it may cause back pain, or of the brain, it may cause headaches, and of the kidney, it may cause blood in the urine. And you would not see these things if it was tuberculosis of the lungs. So I think a common question or an important thing to know would be, at what point should I be treated, or what point should I be seen by a doctor? And according to Mayo Clinic, if you have a fever, unexplained weight loss, you're drenching at night in sweat, or you have a persistent cough, these are signs of tuberculosis that can also result in other medical problems. So you want to go see the doctor for those things, so you can be tested and they can determine the cause. Coughing up blood would be one as well that you would want to be treated for immediately, and so they can figure out what's going on. So the Center for Disease Control and Prevention recommends that people who are at an increased risk for tuberculosis be screened for latent TB infections. This recommendation includes people who may have HIV or AIDS, people who are IV drug users, people who are in close contact with infected individuals, or if you visit an area with a high risk for tuberculosis, and healthcare workers who treat people with a high risk of tuberculosis. I think it's very common that if you work in a healthcare area that you are tested for tuberculosis at least once a year. I know I have to do that for my job, and I think it's a good thing to be tested because we do come in contact with people who have active tuberculosis. So signs and symptoms vary, again, depending on which body part is infected. However, if you have latent TB, you don't feel sick, you usually don't have any signs or symptoms, or sometimes you have a few of them, and you can't spread tuberculosis to others. So it is important to be tested or screened for latent tuberculosis. So now that we know about some of the signs and symptoms and when to be seen by a doctor, I'd like to just talk about transmission and how tuberculosis can be spread. So, as I'm sure was mentioned before, tuberculosis is a bacteria disease that is spread through the air from person to person. The TB bacteria is put into the air when a person with TB of the lungs or throat coughs, sneezes, speaks, or sings. If people walk by or if they're nearby, breathe in this bacteria, they can then become infected. I think it's common that people think that TB can be spread through shaking someone's hand, sharing food or drink, touching bed linens or toilet seats of one who's been infected with TB, sharing toothbrushes, or kissing. However, these things are all not ways that tuberculosis is spread. However, if you are close enough to be kissing someone, it's common that if they cough or sneeze that you could then pick up the TB bacteria. So although tuberculosis is contagious, it's not easy to catch. You're more likely to get tuberculosis from someone you live with or work for instance in a hospital if you're treating a patient with TB. You're more likely to get it from these people than you are just from a stranger on the street. Most people with active TB who have had appropriate drug treatment for the last 2 weeks are no longer considered contagious. So if you do come in contact with someone who is being treated for their tuberculosis and have been for the last 2 weeks, it's not common that they would spread tuberculosis to you. So that's all I have on signs and symptoms and transmissions. Thank you.